So on viral healthcare, we look at a lot of trends, a lot of shiny objects that really organizations shouldn't be tackling, and they do anyway. So we understand that. But today we have a special guest and a special topic. We're going to examine a national trend that started and maybe has plus minus now, but it's really got the application part of it really down, and that's with the Oklahoma Hospital Association and Rich Rasmussen. I'm really glad you're going to get to meet and talk with Rich today. Rich is the president and CEO of the Oklahoma Hospital Association. The Hospital Association serves over 153 hospital systems and health systems in Oklahoma. That includes ambulatory clinics, long-term care, you name it. If it's related to healthcare, Rich and his team talk about it in Oklahoma. He's been doing this for 36 years. He was with the Florida Hospital Association, the Montana Hospital Association, where he was also the CEO, and now he's leading the charge in Oklahoma. So he's got a breadth of experience from across the country. He understands healthcare deeply, profoundly, and the trends that have come and gone over the years. So we're excited to talk to Rich about that. Hi, I'm Bruce Spurlock, a physician and healthcare leader committed to helping decision makers and leaders navigate change with clarity. On viral healthcare, we explore the trends spreading throughout healthcare and what makes them effective, sustainable, and wise to choose. So, Rich, can you, in really a few seconds, give us an elevator speech about your background, the kinds of things you do, and then we'll get started with our interview.
Well, I appreciate it, Bruce. One of the things that I get is to work with folks like Bruce Spurlock. So it's truly a delight to join you guys today. At the Oklahoma Hospital Association, essentially this is what I've done my entire professional life, is to serve as an advocate on behalf of the hospitals and health systems that provide care to our patients in Oklahoma from all across the state. Rural critical access hospitals, rural emergency hospitals, large PPS, small PPS hospitals. And our kind of creed here is that we're focusing on improving health and healthcare in Oklahoma. And what we've developed with the OK Hop is just an example of how we're trying to harness the data that we have and what we clearly know is going on in the community. And how can we create some alignment and ensure that we have opportunities that we can fulfill in improving healthcare in our state. And that's what we do every day. We do it through our foundation. We do it through our advocacy. We do it through our shared services with our members. And that's kind of in a nutshell, Bruce, what we do at the Oklahoma Hospital Association.
I love it. It's a very big nutshell. It's not. It's kind of a gigantic nut that you're actually trying to crack and work with, and I think you're doing great work. We're going to talk about the OK Hop, the healthy outcomes profile, healthy Oklahoma profile.
Mhm.
Now we're trying to figure out exactly how Hop comes in, but it's the idea that we can get very specific on some of the social needs, some of the healthcare needs in communities that surround hospitals and all across Oklahoma. But before we get started talking about that, Rich, I want to talk about this idea of things outside of the hospital, things outside of the healthcare system that affect health outcomes, that make a difference of whether people live a long time, get challenges driving through and navigating the healthcare system. A lot of people have talked about that related to social drivers of health. That's been a hot topic for several years now, and health related social needs. So I'm just curious. Some of these things have been around for years and years and years, very popular. There's been a little bit of pullback from CMS on the DEI and social drivers of health standpoint. I'm just wondering, why would Oklahoma be involved with something like a profile that wants to improve healthcare in your state? What's in it for you and your members?
Well, Bruce, when we look at the care that we deliver across our state, and it's very different communities we have in Oklahoma, and I would venture to say that with most states. We have very rural, rugged communities with significant challenges for accessing care, for ensuring that our patients, our neighbors can continue to develop and can find place for respite as they age, and very different from what we have in our urban corridor. We have rich resources that are available to them. And so I think when we can start honing in and focusing in on what are those, whether they are inadvertent oversights in terms of what we should be focusing in on, and I use transportation as a classic example, where we have, a disconnect in a local community simply because they don't have transportation resources to get to them to a healthcare provider or some other service that's necessary for them to continue to grow and develop in their community. That's something we should be leaning in and trying to provide leadership and advocacy to change that. We talk about how we want to have a connected community worldwide. We can't even connect two towns together because there's not enough broadband to do that. So how can we ever expect to roll out virtual care to somebody where we might be able to provide telestroke services, or we might want to be able to provide real-time sharing of data from a person's own individual a wearable that's essential for them to be able to manage their obesity. How do we do that if we don't even have broadband? So those are really low-hanging fruit, and then we can elevate that certainly into other areas. But in Oklahoma, we're trying to get at those low-hanging fruit that can really have a market improvement in someone's health outcomes.
I love it. You just like in one breath went through 3 or 4 different really trend, innovation, new ideas. You talked about wearables. You talked about sharing information electronically, like virtual meetings, telestroke. I mean, it's incredible just in that. And then you throw in transportation and education and some of the other. Do we have enough health providers in a community for people to get to the access
Absolutely.
to care?
Bruce, how do we get um, to a movement in this nation for better food if we don't even have supermarkets in some rural towns? I mean, I have hospitals that during COVID was providing food to the community because there was no other place for someone to drive to purchase food. So, I mean, really, there's a lot that's going on out here that we have to figure out how we can create a better safety net. And right now, the safety net we have in some communities just is worn out.
So, talk about the role of your members in that safety net and how this, and we'll talk a little bit more at the hop in just a second, but how this information about what's going on in the community might help your hospitals better serve the role that can connect that community as a whole.
Well, you know, if you look at, and let's talk about rural communities, and I think there is some aspects too that certainly are, um, we can find some commonality in rural communities, but in rural communities where there's limited assets as it relates to public health. So the real anchor for public health in rural communities is the local hospital.
Hmm.
So if it's a critical access hospital or maybe it's a rural emergency hospital, as an example, you know, those are the locations that you go for your primary care. Absolutely. For your vaccinations, it's where the kids go before school starts to get caught up on all their vaccinations. It's the emergency room physician or the primary care doc that's also serving as the team physician, at the local high school football team. Everything related to healthcare seems to revolve around that local small hospital. And hence the term critical access hospital, and Congress created that recognition in 1997, is that they are critical to these local communities. And so our hospitals look at this as an opportunity to be able to provide effective leadership locally to advance our goals, which is to improve health and healthcare in Oklahoma. And I would say that's probably the same case all across the country.
Yeah, I think there's something special about rural in particular, but we know even in like large rural or in suburban places, the hospital is often the biggest employer and probably the biggest center point in a community where everybody can identify this is our hospital, this is our sort of center, sort of like City Hall is in other places. It has that sort of anchor kind of nature to it. So we often call the hospital the anchor organization when it comes to social needs and some things. They certainly see it, right? They see the people that don't have enough of the care that they need or the practices or the services or the food, as you described, perhaps transportation, because they usually end up sick in the emergency department in the hospital when they might have been able to be cared for in other places.
Well, absolutely. And we think about that anchor from its healthcare perspective, but that is also an important anchor when you're trying to leverage and create opportunity, economic opportunity in your community. So if Boeing wants to grow its operations in Oklahoma City, they want to make sure that there are enough healthcare resources and there are quality providers in order to be able to serve their employees. And you can take that to any number of industries that are looking for a place to relocate or to build or expand. Healthcare is at the center of that conversation. Education, always. Healthcare is typically number two. when a CEO is making a determination of whether or not they're going to double down on their investment.
So, Rich, describe from your perspective what this HOP is, what the Healthy Oklahoma Profile means, and what it's used for.
Hospitals report large volumes of data. And oftentimes we report that data and we ask ourselves, what do we do with it? We give data to CMS, we give it to state health agencies, we use it internally for our benchmarking or our market development. But what are we doing with this very valuable data to help use it as, part of our planning to improve the health status of our communities? And oftentimes when we look at that data, there might be just one separation from success. So how do we then create that alignment? And so what we look at OK Hop is an opportunity to take the data we have, use that to identify where there are service gaps, where there might be communities that with just a little bit of support, we can dramatically change their diabetes. We might be able to change their obesity. We might be able to drive changes as it relates to other chronic conditions if we just made a couple changes. And so what we've done with the OK Hop is that we've identified these key domains that we're going to focus in on, and we look at what data we can pull from it. So it's not just data from hospitals. Where we can find data, for example, from a Department of Transportation, or it might be from broadband providers as one example. Where do we have these gaps that, again, we can mend the safety net that over time has worn out? And how do we do that? And so that's what we're attempting to do. Our Oklahoma Hospital Council is taking on OK Hop as its project for the next couple of years. And they're going to be identifying individual areas for opportunity that they're going to focus in on. And so one of those areas of opportunity might be, how do we fix a transportation system that simply does not provide a corridor to care? And so can we then advocate on behalf of that to change that local policy or to drive change with transportation planners to do just that? I use it as one example. We meet next Friday, and we're going to be having the full, robust conversation about where do we go with the OK Hop data to make some improvements in the Oklahoma City market.
That's really exciting. It's so interesting when I hear I've talked with other hospital and health systems about this topic, and some of them say, it's hard enough just being a hospital. It's hard enough in the financial environment with all the changes coming down to Medi-Cal and Medicaid and other funding programs. We're going to stay in our swim lane and just focus on that. And what you're saying is, yeah, we got to deal with those things, but if we really want better healthcare, if we really want better health outcomes, we have to sort of look outside of the traditional system and see what we can fix. And there's trickle down stuff from this, right? That we know
Sure.
readmissions will decline if you do that. That's real time stuff. But the beautiful part about it, you're also helping future generations and future outcomes that we're going to be investing in and doing these kind of things. So the question for me is, what is your board and what are the hospitals thinking about the HOP? What do they think they want to do with it?
Well, I think what we want to be able to do is identify where there are areas that we can prioritize. Then we want to bring the payers to the table.
Ooh,
I mean,
okay.
we pay payers. We pay the HMOs, whether it's a Medicare Advantage or commercial or managed Medicaid. We pay them to manage care, which I think anyone that's running a hospital or a physician practice will argue they don't do a very good job of that. So can we create some collective energy around some key goals? And so, yes, the HEDIS measures are important, but does that really, create that opportunity to mend the safety net? And so if we can find that way to bring the payers in on this, as well as the hospital community, then we now have some gravitas to move forward on. And so I think that is going to be the next evolution for us. And why is that all important? Because hospitals are being held accountable for outcomes. The health plans will tell you they do that. It's really the hospitals. It all falls back on us. So it's important that we make sure we create the best environment for a patient to recover and to become healthy and successful again. And we want to make sure that there's no impediment to that happening. And again, some of these key indicators are so simple if we can just create the right gravitas around it, like transportation, like broadband and these other pieces where Bruce, we as a country are going to spend $50 billion on what we're doing as it relates to the Rural Health Transformation Plan. And a lot of this is being focused on how do we provide more virtual care. We want to be able to make sure that we have a plan to make sure that that works.
You know, what you're describing is kind of innovative from my perspective. I've seen hospitals tackle this. I've seen health plans tackle this. I've seen community-based organizations, but what I haven't seen is this private sector alignment and collaboration. And that's kind of what you're describing. How can you work with the private sector in the payment world? And how can you work with the local folks and your individual hospital organizations to address the needs of their community? I think that's really exciting. I think it's innovative. It's not very frequent that I see this around the country. Why will you be successful in Oklahoma because of this approach?
The leadership that we have in our hospitals are all committed. To be at a performance level where we are, let's use the America's Hospitals rankings, our members believe we can do much better. And so even if we're performing somewhere in the median as it relates to the clinical pieces of this, there's so many other pieces of these rankings that are outside our control, that are really public health related. There are other issues that the state has the ability to influence. So we're going to use our work to be able to try and influence the state in this manner. And if we have to start at local jurisdictions to do that, we will start at local jurisdictions to do that. We don't want to be stuck at 45th, right? So for us, we want to be, our goal was to be at 30 by 2030. That's going to slip a little bit, particularly with these Medicaid cuts that are coming, but we still remain 100% committed to moving and advancing ourselves to a better place of healthiness in Oklahoma.
It's so interesting because I was going to ask you about where's the role of the public sector? What's, the role of government? And it sounds like starting even locally or smaller might be a way to prove to other people like at the state level or in regional levels how you can have success. This is what we're doing really well in this community. And how do we replicate it, spread it, and get it to go across the entire state?
Well, and if we look at what we were able to do with OK Hop, the development was funded by the Tobacco Settlement Trust Fund in Oklahoma. So when the state sued Big Tobacco, they settled that. It created a really nice corpus. And from that, the earnings, they're making major investments. They invested TSET in the development of this tool. I believe that this tool can be used by any number of organizations, not just hospitals. So as local funders, whether it's philanthropy, local government, are trying to make decisions on where they want to make investments, if we can show them that there is an opportunity to move the needle, and we can show it empirically from this data, it really helps to create some prioritization that typically doesn't exist. Usually we know the squeaky wheel gets the oil. What we want to be able to do is we want to demonstrate that if they make an appropriate investment, it's going to yield in a health improvement outcome.
Yes, success begets success, right? You want a proof of concept, you prove it, and then you spread it and make it happen elsewhere. Okay, so Oklahoma, I think, is ahead of the game on this kind of thing, at least at the statewide level. What would you talk to and tell other either state hospital associations or anybody working in a different area of the country why they should consider it, what they should do, and how they should be approaching this in their state or in their communities?
Well, Bruce, when I was at the Montana Hospital Association, we started the development of a very similar tool there. And when I came here, I wanted to bring it here as well. I believe that this is the way in which we can, in a very collaborative model, be able to pull different sources of data and truly create a strategy for health improvement. What's unique about what we've done, and I think it can easily be replicated, is we brought in multiple stakeholders. So whether it is chambers of commerce represented in the work group, hospitals represented, state departments of health, departments of transportation, offices of rural health, there is a way in which we can bring together everyone who is focused on the same thing, which is great outcomes and a healthier community. This tool provides the real benchmark for all of us to measure ourselves against. And it is not rocket science because we're collecting this data. We're just not connecting it together so that we can develop a strategy around it.
One of the amazing things, and again, I think I don't want to make this overly political, but I think just about everybody gets that we can improve health outcomes. Everybody gets that. Doesn't matter your persuasion, are you red or blue or green or orange or whatever you are. I think they kind of understand that it really does take this sort of collective effort to think about health outcomes being improving and different solutions for different communities, different priorities for different places, different needs that even at the micro level are important for us to think about addressing. So this feels like it doesn't have to be just a blue state or a red state kind of thing. It could be anywhere in the country to track this down. Is that your opinion too?
Oh, absolutely. I mean, this shouldn't be partisan. I mean, when we're trying to improve health outcomes of our neighbors, we shouldn't ask the question, are you blue or red to begin with? I mean, do you need help? Do you need assistance? Do we have the ability to solve it? And if we can put someone on the moon, we can solve this health disparity issues that we have across this country. And oftentimes it's right in front of us. I mean, it's right there, and we see it in our data. It's right there. We can see, looking at the heat maps, where we need to focus. And by moving a slider a couple notches, we can see exactly how we can zone in, and we should be looking this as not, a challenge, but an opportunity. And that's how we look at it, as an opportunity to improve the health outcomes of our neighbors here in Oklahoma.
I couldn't have said it any better. Rich, is it okay if we ask you back when you're getting a little experience and you're having some success to come share it with us? I'd love
Oh,
to have
a
the
hundred
audience.
percent. Absolutely. And I, we will be looking for other places to tell this story. And so you might see OK Hop might be popping up at an AHA meeting, national meeting, someplace in the near future, and other opportunities that we can find to tell this story. Because I think evangelizing what we're doing here is how we're going to get folks to re-examine how they do it. It's easy to keep doing the same thing over and over again. What we've tried to do is we tried to step back and reimagine what we could be doing, and that's the fruit of this is what we've got with the OK Hop.
Well, there you have it, folks. Innovation, leadership, a bigger view of the world happening right in Oklahoma, right in the heart of our country, in a place that really needs it, but then every place really needs it. And Rich has got the vision and the political insights and the ability to bring collaboration together to make it happen. I'm really thrilled, Rich, that you're here. Thanks a lot for joining our show.
Well, Bruce, thanks for inviting us, and we look forward to coming back again.
So if you're involved with innovation or trends, share this episode, share this conversation with others. And I'm sure either one of us be happy to talk with you offline if you're interested in learning more about the OK Hop, seeing how it was developed, what does it mean, what does it look like, and we're excited about getting this idea out in front of a lot of folks. I'm Bruce Spurlock, and if you enjoyed this episode, we look forward to seeing you in the future. Thank you.
Thank you.